Hi, my name is Nathan Odell,
And I'm Drew Standifer.
and we're student physical therapists here at Marshall School of Physical Therapy. Today we're going to be demonstrating a treatment for a pulmonary disorder. To show that this demonstration isn't referenced, feel free to pan the room to see if there's no notes or informational references on display. Alright, we're going to begin. The technique we're going to display is called active cycle breathing technique. This is a technique that's meant to improve ventilation and also to expel excess secretions in the lungs. This technique is very beneficial for patients that have obstructions in the lungs or an obstructed airway, and the point of this is to help clear that. Now, for active cycle breathing techniques, there are three phases. The first phase is breathing control. We're going to have our patient here breathe in through their nose and out through their mouth. The point of this is to have a nice, slow, controlled breath. We're going to encourage our patient to keep their shoulders and their chest relaxed and to focus on breathing through the stomach and the diaphragm, allowing the diaphragm to descend and the lungs to expand and then to recoil. The patient's going to take 3 to 5 breaths to prepare for the remainder of the treatment, making sure that they go in through the nose and out through the mouth. Sometimes it'll help if the patient puts their hand on their stomach to have that stimulus and to help kind of guide them to push out with their stomach rather than with their chest. Once they've completed the breathing control, the next step is thoracic expansion. We're going to have our patient put their hands on either side of the thoracic cage. They should feel their hands on the inferior angles of their ribs. We're going to have our patients take a deep breath, again through the nose and out through the mouth. With each breath, our patient is going to focus on expanding at the rib cage and then compressing. It helps if you tell your patient to inhale and rather than push out forcefully, to let the intercostal muscles recoil and let the air flow out naturally. Our patient's going to perform 3 to 5 of these breaths. At the conclusion of this phase, our patient can either go back to breathing control or can continue to the last phase. The last phase is called huffing. The point of this is to help expel any obstructions or secretions in the lungs to improve ventilation. We're going to tell your patient to breathe out forcefully, almost as if they were trying to fog up a mirror. You can have the patients have that visualization in mind as they try to huff, if they will. While doing this, sometimes the patients will get the urge to cough or try to expel any secretions that might be dislodged from the huffing. That concludes our demonstration of active cycle breathing techniques. In a physical therapy setting, it's important to consider a patient's pulmonary disorders as well as any musculoskeletal disorders in the full treatment.
And you can like, comment, and subscribe for more videos.